My name is Julia Toleneva. I'm a student nurse practitioner here at LAU. How are you today?
I'm good. I'm well. Thank you for asking. How about you?
I'm great also. Can you tell me your name and date of birth, please?
Sure. It's Deanne Thompson, 4/26/1982.
Can you tell me where we are?
Yes, I'm in the lab at LIU.
Okay. And can you tell me what you had for breakfast this morning?
Sure, I had a smoothie.
And tell me, please, what you wore when you graduated nursing school.
Again.
Okay. And can you count from 1 to 5?
1, 2, 3, 4, 5.
Perfect. And can you spell the word rose for me?
ROSE.
Perfect. So now we're ready to start our head-to-toe examination. Before that, I'm going to wash my hands and do a set of vitals on you. Starting with the blood pressure. Temperature, and your respirations are 16, temperature is 98.2, and your pulse ox is 98%. Perfect. So we're going to begin our examination. So your skin is smooth, intact, and elastic. Skin turgor is good, with good mobility. Temperatures are good bilaterally. There is no scarring, no lesions. Same as the back. There is no cyanosis. Your head is normocephalic, round, and symmetrical. I'm going to check for any bumps, lumps. I don't feel any. There is no lesions. No bald patches, no lice, no scaling in your head. Your face looks symmetric. There is no drooling, no ptosis of your eyelids. Your lips, you have pursed lips. You're not in any labored breathing. So the next thing, your eyebrows are symmetric, your eyes are of equal sizes bilaterally, the palpebral fissures are of the same size, your upper eyelid covers your iris, portion of the iris, which is of equal color. Your cornea, I'm going to shine the light, cornea is smooth. The lacrimal system with the lacrimal gland, the lacrimal apparatus, sac, and the lacrimal sac intact. There is no drainage, no redness or swelling. Can you look up for me? Your sclera is white, your conjunctiva is red, which is normal. So your eyes are in good health. The next thing we're going to be doing is testing your eyes. First test is test for visual acuity. This is the Snellen chart. I'm going to hold it 6 feet away from you. And can you please read through the smallest line possible, covering one eye at a time?
LTFPH. LTFPH.
Perfect. And your vision is 20/20. The next test is going to be with my pen light. So it's called... Actually, we're going to do the confrontation test first. So you're going to look straight into my nose and tell me when you see my fingers from the peripheral vision.
See.
Okay, good. So now we're going to do a test called 6 cardinal vision of gaze that tests cranial nerve 3, 4, and 6. And just follow my pen light without turning your head. And keep looking at my pen, and good. Your eyes converged. So peripheral vision is good, and convergence was good. Now I'm going to ask you to look far away, and now look at the pen light. Good. So that's accommodation. Your pupils dilated, and when you look here, they constricted. The next thing is pupillar light reflex. I'm shining the light in the right eye. Your left pupil constricted, so that's direct and consensual reflex. I'm shining the light into this eye, direct reflex, and this one constricted consensual. So your pupils, I could see also that they're equal in size, round, and they're about 3 to 5 mm in size. So we have parallel pupils, equal, round, reactive to light, and accommodation. There's no nystagmus noted when I tested your eyes. The next thing we're gonna do is I'm gonna be checking your eyes, your eye structures with my fundoscope. So the way to do it, I'm gonna be setting it to 0. I'm gonna find the red reflex, follow it through all the way into your eye until I see some blood vessels. I see there's no opacities. I see a physiological disc and the physiological cup. The cup is 1/3 of the disc. It's creamy yellow. I see the macula. It's a little bit darker in color than the rest. Very good. And then I'm going to do the same thing with the left eye and find the same structures. So, good. Your internal organs of the eyes are good. There is no glaucoma, no cataract, or any type of abnormal vision changes that I can see in your eyes. The next thing is we're going to be doing your nose. Your nose is symmetrical, and the nostrils are equal sizes. There is no drainage. So I'm just going to look inside your nose, and I could see some cilia present there, some turbinates that are red, but they're not inflamed. There is no drainage, no septal deviation, no perforation. Can you close your eyes for me, please? And tell me if you could smell that and what it is.
Alcohol.
Good. So that's cranial nerve number 1, olfactory. And the next thing we're going to be doing is moving on to your ears. Before I move on to the ears, I will be checking your temporal artery for pulsations one at a time. Your maxillary sinuses, your frontal sinuses. Any pain or tenderness there?
No.
Your TMJ, open and close your mouth. Good. No clicking, no tender, no pain. Your ears, I'm going to first do a test. It's called whisper test. So just repeat after me.
White. Hello.
Good. And then I'm going to use the tuning fork to check for Weber and Rinat test. I'm going to strike it and tell me where you hear the vibrations.
In both ears.
Great. And now again, I'm going to strike it again and put it over your mastoid process. Tell me when you hear the vibration and tell me when they stop.
I feel it. It stopped.
Do you still hear it? Good. So that was the test to check for the bone conduction. So your AC conduction is greater than the bone conduction. And after we're done the test, I'm going to check your ears. It's okay. Your ears for symmetry. They're symmetrical. They're equal sizes. I'm going to palpate. Is there any pain?
No.
There's no nodules, no inflammation, no drainage. Any pain over your auricle?
No.
Your tragus?
No.
Perfect. Okay. I'm going to be now checking your ears internally. Looking at the structures, so I pull it up and back, and looking inside your ear, I see some cerumen, I see some cilia, I see the cone of light in the right ear is at 5 o'clock, and the left ear is at 7 o'clock. I see some, I also see that there is malleus, pars flaccida, the umbo structures. There is no perforation, no drainage inside. I see the tympanic membrane shiny, translucent, and pearly white. No otitis media or any type of infection that I saw in the ear. And actually, I'm going to check the other ear. And I will be doing the same thing, same structures, and it's all good. The next thing we are going to be assessing is your mouth. So your membranes are moist, and you don't have any pursed breathing with your lips. So if you can just open and close your mouth and say, good. And I'm going to actually use a tongue blade. This will check and the tongue blade, cranial nerve 9 and 10. Gag reflex. Good. Okay. So inside your mouth, let me just check. Very good. And I'm just gonna go in and assess your tongue and your buccal mucosa.
Okay.
And your tongue moves freely. Stick out your tongue. Cranial nerve number 12. Your buccal mucosa, there is no ulcers. It looks pink. There is no type of patches, no erosions. Your gums are there. They're not loose. No dentures. Dental hygiene is good. No halitosis. Your uvula is midline, and your tonsils are about +1, +2, no exudates, and they're not extremely red or inflamed. They're actually normal pink. The next thing we're going to be doing is I'm going to be assessing your lymph nodes, okay? So I'm going to start palpating pre-auricular, posterior auricular, occipital, submental, submandibular, sublingual, superficial cervical, anterior cervical, posterior cervical, supraclavicular node. And the nodes are not, they're not fixed, they're not tender, they're not enlarged, no inflammation there. The next thing we're going to be doing is I'm going to check your neck. Your trachea is midline, it's not deviated to right or left. It's in line with your head. I don't see any goiters or any enlargements. I'm going to palpate your trachea now. Good. And your thyroid gland, we can also do it from the back. So I'm just going to ask you to swallow. Good. And when you did that, your cricoid cartilage moved up and down. And I don't see any tracheal enlargement, thyroid enlargement here. Everything is intact and non-tender. No nodules. Okay. The next thing we're going to be doing is actually, we'll stop at the neck, and I'm going to start with your, lung exam, okay? We're going to be checking your lungs. So when I first inspect, we're going to do inspect, palpate, percuss, and auscultate. When I inspect your lungs, I see that they're symmetrical, the diaphragm moves up and down, symmetrically, your shoulders are equal size. I don't see any labored breathing. So first, like I said, will be, also when I'm in the back, in the posterior, I'm going to do some tests and start with the posterior diameter, but first I'd like to say that your AP to TD diameter is 1 to 2. And then I will, if you just move, can you just kind of face that wall over there?
Sure.
Thank you. So what we're going to do, I'm going to measure the symmetrical expansion. So I'm going to pinch and ask you to take a deep breath in. Good, and my fingers went apart, so your lungs, they expanded symmetrically. The next thing what I'm going to do is I will be palpating your lungs, and I'm going to ask you to say 99.
99, 99, 99, 99, 99.
So I'm palpating for tactile parameters.
99, 99, 99, 99.
And good. And the next thing I'm going to be doing is percussing your lungs. So when I percuss, I'm going to start from the very top. And there is resonant sound over the lung tissue, same as anterior diameter. And in the posterior, I'm going to check for diaphragmatic exertion. So I'm going to ask you to exhale and hold. So I go down until I no longer hear resonance. And then I ask you to take a deep breath in and hold. And I'm going to mark this area. So this is actually a test how much your diaphragm moves up and down, and that's about 3 to 5 centimeters, and yours is about 3. Okay, the next thing we're going to be doing, I'm going to percuss the front. Okay, resonant lung sound, and then I will be auscultating. So just, I'm going to actually, I'm supposed to do 1 full minute, but for the lack of time, we're just going to start at the very top and go in a zigzag pattern down, listening to your vesicular lung sound, which is over most of your lung tissue. And can you say E?
E.
Good.
E.
And can you whisper blue? Good. So that's egophony and whispered pectoraliquid. Same thing here. I'm going to listen in zigzag, starting from the top, going down, and ask you to say E.
E.
And blue.
Blue.
Whisper. Good. Okay, perfect. So we auscultated, percussed, and palpated. So the next thing, I'm going to check your cardiac examination. So if you just want to face me. And for your cardiac exam, I'm pretty much looking to, first I'm going to be checking your pulse to make sure it's nice, regular, strong, and bound. Very good. The radial pulses are big. The next thing I'm going to do is I would measure your pulse deficit but I need a second person. So I would check the radial. I have another person listening in your PMI, point of maximal impulse area, and we listen at the same time, and then we subtract. So that would be pulse deficit. The next thing is I'm going to name the anatomical, so the structures. This is aortic valve, right second intercostal space, pulmonic left second intercostal, tricuspid about 4th intercostal space, and mitral 5th intercostal midclavicular line. And this is the PMI, point of maximal impulse. So now that I named it, I'm going to be checking and listening with my bow. Just breathe normally. With my diaphragm, I'm sorry. And now I'm going to, where I get to PMI, can you lean forward? Great. And now I'm going to turn to the bow and do the same thing with the bow. Now can you lean forward? Good. So then the next thing I'm going to do is I'm going to ask you to go 30 degrees, head of the bed 30 degrees. Lay down, please. And I'm inspecting now your carotid, your JVD. For any distension there, I'm going to ask my patient to turn to the left, shine the light, and the JVD is not distended. I do see some carotid pulsations there. Sometimes you may see the aortic pulsations as well. But now, after I inspect, I'm going to listen to your foiny bruit with my bow. So hold your breath, take a breath and hold. Okay, good. And now I'm going to palpate your carotids. I'm going to palpate for any heaves or thrills. Palpate in the PMI area. Okay, that's good. And the next thing we're gonna do is listening to you 30 degrees. So again, with the diaphragm and the bell. Okay, good. And the next thing we're gonna be doing is actually the abdominal examination, and your abdomen is symmetric, and there is no protrusions, no bulges, no hernia. Umbilicus is inverted and midline. And first we inspect, percuss, palpate, and auscultate with the abdomen. So I'm gonna be now auscultating in all 4 quadrants, beginning with the right lower quadrant. And I hear some vowel sounds there. And then the next thing is I'm gonna check for your aortic, for any bruise in your aortic artery, renal, femoral, actually iliac, and femoral. Good. And then I'm gonna be percussing in all 4 quadrants, and I hear tympani. And then I'm going to be percussing the liver border. So we start with the midclavicular line and going down until I hear some dullness. Mark the area, and then start from the bottom, going up until I hear dullness. Mark the area. And when I measure, this area should be about 7 to 12 centimeters, and yours is 8. The next thing is I'm going to percuss the spleen area. Ask it to go a little bit on your right side. Thank you. And percuss over the splenic area. And there is tympani. And take a deep breath in. And I still hear tympani, so that's the splenic sign. So that's good. And the next thing I'm going to do is palpating your abdomen. So I'm going to do light palpation first. Check for any masses, any bulges, any pain or tenderness.
No.
Good. I'm going to palpate the liver edge. I'm going to use a hooking technique, so I'm going to actually put my fingers in, take a deep breath in, and I could feel the liver border slip onto my fingers. And with the spleen, I'm just going to go on, and actually to palpate the liver, I can go deep around it like this, and then the spleen, I hold it here and I palpate as you take a deep breath in. I palpate under the spleen area, and if your spleen was enlarged, I would definitely feel it. Okay, and then we do the deep palpation to check for all the organs inside. And deep palpation, good. There is no tenderness or pain in that area. Okay, perfect. So you can actually sit up for me. And we're moving on to the musculoskeletal part of the exam. So I will be starting with just assessing your neck area in the back, your bony prominences, they're not inflamed, non-tender, they're all in imaginary line. So for your neck, like I said before, it's symmetric with the trachea in midline. So I'm going to ask you to do lateral bending, rotate left and right, and then touch with your ears to the shoulders, touch with the chin, and so that was flex and extend. Perfect. Any pain there?
No.
No. And then since we're here, can you shrug your shoulders for me? Good. And that's cranial nerve number 11. So now we're going to be moving down from your neck area. We're going to be going down. I would like to assess your spine. So can you just take a walk for me? Perfect. And back. Perfect. Okay, good. So now you can go back to bed. And before I move on to talk about your spine, I do need to check your pulses. So we do radial, brachial, popliteal, femoral, and dorsalis pedis, and tibia dorsal, and the one in the back. So the next thing is, actually we did not do the CVA for kidney. Just checking your kidney punch and your inguinal nodes. If you lay down, they're right there. Okay, perfect. So your spine is your spine and gait. Your gait is well coordinated. There is no assistive devices. There is no limp, no shaking. You walked without an effort. So you have no lordosis or kyphosis, and your gait was pretty good. So actually, can you go on the floor for me and bend down? We're gonna check your range of motion. Flex. So there is no scoliosis. Hyperextend. Lateral bending. Here. Rotate. Okay, perfect. The next thing I'm gonna be doing, actually, if you wanna stand up, I'm gonna check your shoulders. Your shoulders symmetry is good. It's even. There is no gross deformity. There is no deviation of the shoulder. I'm going to check starting in your clavicle, go to your AC joint, your brachial groove. Any pain there?
No.
Good. So there is no tenderness, warmth, or pain there. So now we're going to do range of motion for the shoulders. So you're going to flex 90 degrees, 180 degrees, hyperextend. You're going to abduct, adduct, crossover. This test for AC joint, if there's anything wrong with the AC joint. And internal rotation, external rotation. Scratch your neck. Perfect. So after the shoulder, we move on to your elbow. So your elbows look good. Olecranon process is not inflamed, no deformity, no arthritic changes. Your olecranon processes look intact. So now the range of motion for the elbow: hyperextend, flex, pronation, supination. Okay, good. Next we move on to your hands and wrists. So your wrist, I'm gonna first assess there is no deformity, no nodes, Buchan or Herborden nodes. Your hands look symmetrical, they're not deviated. There is no rheumatoid changes, no inflammation, no tenderness there. Any tenderness?
No.
When I touch? No.
No.
Good. Your MCP, your PIP, and your dip joints are all good. They're not inflamed, no pain there.
No.
Good. So now the range of motion for the wrist: flex, extend, a radial deviation, ulnar deviation. The hands is abduct, adduct, extend, flex. Perfect. No pain there, right?
No.
Okay, perfect. And then we're moving on to your hips now. So your iliac crest looks symmetrical. Gluteal folds are symmetrical as well. From your gait, I saw that your hip motion is not labored. So I'm going to ask you to get on this table for me. And go on your side first. Lay on your side. I'm going to assess your truncated bursa. And thank you. And it's not tender. There is no pain or tenderness there. Good.
No.
So lay on your back for me. Okay, we're gonna do. Gonna go flat. Okay, perfect. And now I'm gonna do some range of motion. Flex, and then extend, and do the same thing with the other leg. Flex, extend. And then we're gonna do abduct, adduct, abduct, adduct, internal, external, internal rotation, external rotation of the hips. Good. No pain there, correct?
No.
Okay, so let's do your knees now. You can get up. And now for your knee exam, I'm going to ask you to stand up. And I'm going to actually first assess your patella, the olecranon processes. Look symmetrical. There is no effusion, no tenderness. Ischial tuberosity looks intact. So the range of motion is flex, extend, and flex, extend. That's it. The next thing we're gonna do is your feet. So if you could just sit on the table for me again, and your feet are good. There is also no nodules, MCP, PIP, and dip joint look good. So technically we're going to take off one sock actually and assess there is no any deviation or anything. So can you abduct your fingers and abduct? Good. Okay, and so for the feet there is also no gout. Can you flex, extend, inversion and eversion? Okay, perfect. So now I believe we're done with the musculoskeletal system part of the examination. We're going to be moving on to do the motor skills. So if you want to put your socks on, and we're going to be testing now I'm going to first test your motor strength. So when I take your limb and I let go, it doesn't just fall easily. So you have some coordination, you have coordination in your lower extremities, and now we're going to assess some strength. So I'm going to ask you bilaterally, can you try to push up, push down, and with your hands push down and push up. Good. And now I'm going to ask you to lay down. Actually, can you push up with your leg? Good. Good. And now bring it up and try to push me. Good. Good. And your feet push up. Push up. Good. So your motor is intact. Your strength is there. There is no spasms, no type of involuntary movements that I saw. And your strength is 5 out of 5. The next thing we're going to be doing is I'm going to ask you to actually stand up for a second, and we're going to check your upper extremity drift. So stand up and extend your arms. Good. And there is no drifting here or there. So the next thing is the sensory part of the examination. So close your eyes. Actually, you can just lean over. This test is going to be done with your eyes closed. So I'm going to ask you to close your eyes and try to recognize, let me give this. Close your eyes and tell me what this is.
Okay.
So that's stereogenesis. You were able to recognize. Now you're going to close your eyes and I'm going to tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Dull.
Good. So now you could feel pain and you could differentiate between sharp, dull, and we did the stereogenesis. And also tell me with your eye closed if you feel the vibration.
Yes. 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 Yes.
Perfect. Next thing is the balance and coordination testing. So I'm going to ask you to walk heel to toe. And now walk on your toes and your heels. And now go from this leg down and like this. And let's do Romberg test. So you're going to go like this and close your eyes, and I'm going to support you from the back. And you're not falling, you're not losing your coordination. Perfect. And now I'm going to check for your reflexes. So I'm going to be doing, starting with your brachial reflex, both sides, brachioradialis, tricep, just relax, patellar, Achilles, and then when you lay down, I'm going to go like this and do the plantar reflexes. So we're pretty much finished for the examination, but since I have a little bit more time, I just would like to make sure that I did all the cranial nerves and that I covered all of them during my examination. So like we said before, the first one is olfactory, is the smell. Second is the optic. 3, 4, and 6 oculomotor. We tested your eyes. 5 is facial, and also I could do a cotton ball and see if you feel any sensations.
Yes.
Good, and clenching your jaw. 7 is your facial expression. So can you puff out your cheeks, frown, smile? Good. So that's 7. 8 was your hearing, acoustic. And then 9 and 10 is when you open and said ah and the gag. 11 is when you shrugged your shoulders, and 12 was when you stick out your tongue. And I'm just trying to brush it off and see if I forgot anything else anywhere. Since I do have some time, I just want to see if I forgot anything, but I think that's it. Thank you very much.